This is Todd Neal with MedPage Today at the American College of Chest Physicians meeting in Philadelphia. Virginia Reichert, a nurse practitioner at the North Shore Long Island Jewish Health System Center for Tobacco Control in Great Neck, New York, presented results of a survey of knowledge about tobacco dependence among healthcare professionals.
So this survey had 17 questions, and it looked at the prevalence of smoking. Very straightforward. What is the prevalence of tobacco use in the United States? All over the map. People don't even know that. Where are the treatment guidelines from? What agency? It asked about pharmacotherapy for tobacco cessation. It asked about the interaction of nicotine with other drugs. So in order to know those questions, they had to know that nicotine went through the cytochrome P450 pathway. People don't know that either. What are the symptoms and implications of nicotine withdrawal? And then we asked them how many hours of training, professional training, had they received on this topic. And the information we got was pretty astounding. Out of the 600 healthcare providers, only 6% of the prescribers knew that there were guidelines and where they were. And it's from the Agency for Healthcare Research and Quality. Only 16% of the prescribers knew which FDA-approved medications were over the counter and which were prescription. And on the paper, on the survey, it had all the answers to every single drug that's available. Just circle the ones that are over the counter, circle the ones in the next question, same exact choices, which require a prescription. Even having them all in front of them, only 16% of the prescribers knew them and only 8% of non-prescribers. So if you don't know that a nicotine patch is over the counter, how are you going to help these people? 1% of prescribers and 3% of non-prescribers correctly identified the signs and symptoms of nicotine withdrawal. And there's more non-prescribers because in our full-day conferences, we get a lot of certified alcohol and substance abuse counselors coming for the training because it's mandated now by OASIS. So I think that 3% was a little bit of bump because of those counselors coming for the class. And they know what the signs and symptoms of nicotine withdrawal. It's the same signs and symptoms for other withdrawals as well. This was good news. 45% of prescribers knew that seizures were a contraindication for taking bupropion. I feel bad for the other 55% who didn't know that and prescribed it for people who had seizure problems. But 48% of prescribers and 34% of non-prescribers answered true that yes, insulin requirements decrease with the cessation of smoking. So I was looking to get information if they knew about the abrupt cessation of smoking in the hospitalized smoker. So yes, their insulin requirements do go down by 30% in 24 hours. 28% of prescribers and 33% of non-prescribers answered true, correctly, requirements for warfarin or Coumadin are less once people quit abruptly. 78% of prescribers and 60% of non-prescribers say that they advise their patients to quit at every single visit. And 39% of prescribers said that they have had success with getting their patients to quit versus 12% of non-prescribers. But to me, if you were a prescriber, 40% of them are saying they're getting some success with helping people quit without knowing anything. Imagine how successful we can be at this if we did know what we were talking about.
In Philadelphia, I'm Todd Neal, MedPage Today.